Assalamu alaikum everyone. So today we're going to race through Myasthenia Gravis. It is a neurological problem and one of the worst ones in which you get weaker as the day goes on. So this is a question that usually comes in the exam. Miss Megan Fox presented to room 28. Okay, the focus things are drooping of the eyelids, weakness of the arms and legs, worst in the evening. So associated usually with a mediastinal opacity on chest x-ray, and the symptoms are improved early in the day or on rest. What is the most probable diagnosis? The probable diagnosis is myasthenia gravis with a thymoma. So here is drooping of the eyelids. It is an autoimmune disease. It involves the NMJ. It has weakness and fatigability. The more you use the muscles, the weaker they get. So basically, antibodies to nicotinic acetylcholine receptor AChR present in 80 to 90%. And other patients, the rest of patients may have antibodies to the surface of muscle membrane. MuSK antibodies are present in 40% of the rest. It can be seronegative in some patients. Here is the NMJ, and here you can see antibodies being attached to the postsynaptic acetylcholine receptors that is causing all this problem. So the functional receptors become less, so they cannot be recruited, so the muscle contraction is not generated or formed. Majority have thymic abnormalities, hyperplasia, or even thymoma, and disease often improves after thymectomy. So thymus maybe perhaps is involved. So more younger women are affected more than younger men. Older men are affected more than older women. Autoimmune, other diseases are present. Thyroid diseases are present in 5 to 10%. Most common NMJ. Again, ocular findings are present. Ptosis, diplopia, dysarthria, dysphagia. These are the bulbar complaints or the cranial nerves complaints that you can get. Facial weakness and weakness of muscle mastication can also be there. So these are some of the symptoms. Speech may be nasal, regurgitation can happen. Very important, the proximal muscles become more weaker than the distal muscles. Arms are usually more affected than the legs, and extensors are preferentially. So the more you use the muscle, extensors are used more, arms are more than legs, and the proximal the more used usually. So these are the muscles that are more weaker. Respiratory muscle weakness can spell disaster. So myasthenic crisis, the complication, you need to remember that it results in respiratory failure and you need to intubate the patient. A big majority, 20% of patients face it through their lives, precipitated by infection respiration, and it is a very important complication. You need to send the patient to ICU. Here are some of the differentials. So for diagnosis, it must be clinical. You need to get some immunological diagnosis, electrophysiology. Some tests are also there in which repetitive nerve stimulation has 75% sensitivity, and single fiber electromyography, it's difficult to do, but 95% sensitive. You can also do the tensilon or stigma test. Ice pack test is an easy test. You put ice packs on the eye, and cold temperature makes the symptoms less severe. Here is, if you want to see sensitivity of the tests, you also need to do these tests to find out associated things. Treatment. So acetylcholine esterase inhibitors will increase the level of acetylcholine. The more the acetylcholine, the more receptors it can bind to. So pyridostigmine is usually given. More frequent dosing is needed. So but you need to adjust it according to the symptoms. So here is some dosage of pyridostigmine or neostigmine if you're thinking of using that. Thymectomy can also be used. Now, very important, immunosuppressive therapies are mainstay of treatment. You can use steroids. Steroids can cause initial weakness in the first 2 weeks, then improvement, and 80% of the patients benefit with steroids. So you start around 20 mg per day of dexamethasone, delta cortyl, enteric sorry. So you start with that, and then you increase the dosage till response is evident. As the thiopurine is also used, can be used with or without steroids, is also beneficial, but it takes a long time to show benefit. Other improvements of immunosuppressive treatment are coming. So if you require short-term or immediate treatment, these are the two routes you can go: plasmapheresis or IV immunoglobulins, and especially for myasthenic crisis, these are important. Some drugs can cause myasthenia. These are some of the drugs. Also, there are some drugs you cannot use in myasthenia. Really important to consult the table when you're dealing with a myasthenic patient. This is a list of drugs. And thank you so much. I hope you learned something about myasthenia. And if you guys have any questions, then you can ask them in the comments, and I'll be happy to answer.